I do see someone from Gilbert, Arizona. Just a little shout out. Thank you. You guys do an awesome job getting the water tower. I think it's a water tower lit up green.
Right.
I'll just give it maybe another minute or so. Seem to be just a few more people logging on, and then we'll get going. Christopher, how's it looking? Do we seem to be slowing down there? We're good to go. You are muted.
Yes, sorry about that. We should be good to go.
Okay, all good. And we are recording, correct? All right. Well, hello, good afternoon, everybody. My name is Susan Frankel, and I am the CEO of the National Runaway Safe Line. Welcome to everyone. We are excited to be with you today and to share the information that we have planned to share out with you and to have some very good and robust conversation about this information and what the data is telling us and how we can all collectively learn from this information and use it to continue to do the great work that I know all of you are doing. Just a few quick housekeeping or logistical items. You should know this already by virtue of having logged on, but just to reiterate, we are recording the session. And it will be made available and accessible if there are other folks, perhaps from your teams or your offices or communities, who would like to watch as well. This will be shared shortly after. There was a little bit of a timing delay for the access to the full the 2021 Crisis Services and Prevention Report. It is now available for download on our website, and Christopher will, I'm guessing, post that in the chat. As we go through the presentation and are sharing all of this great information, please feel free to comment in the chat, to pose questions, to raise your ideas. We have a number of team members on who will make sure that those are brought to the speaker's attentions and that we address those questions. And then we have left time at the end of the session as well for a little bit of Q&A. So with that, I have introduced myself. I want to introduce my co-presenters here, Sam Gillis, who is our Chief Program Officer from the National Runaway Safe Line, and then Dr. Melissa Cull, Senior Researcher with Chapin Hall from the University of Chicago. Collectively, Sam and Melissa have been instrumental really in all of the and pulling this information and the report together. So we're super excited to have them here and to share that information with all of you. As we get started, I'm going to spend a little bit of time just telling you a little bit more about the National Runaway Safe Line, do a shameless plug for National Runaway Prevention Month. Hopefully some of you are wearing green as we speak, as it is National Wear Green Day, and we are certainly having a lot of fun with that here at our offices in Chicago with the Safe Line, and hope that you are as well. And then we will really just dive into really the heart of the information and the data and share out this great presentation. So I do want to also just acknowledge and thank our partners from the Family and Youth Services Bureau. They are instrumental also in being a part of bringing this data report to fruition and ensuring that we're able to share this out with you. So thank you to them. I do know that there are some folks from HHS or ACF and FISB on the call. So welcome and a special shout out to you. And I do know there also just want to recognize there are a handful of other National Runaway Prevention team member or National Runaway Prevention. I've like merged our name with National Runaway Prevention Month, but National Runaway Safe Line team members as well. Christopher Smith, who is not only helping to make sure that things are running smoothly today, but who is our Director of Marketing and Communications, will give a little bit of a wave. M. De Cordova has joined us, who is our Prevention and Youth Engagement Coordinator. And I know that Emily Rupp, our interim CFO, has joined the call. Devin Fuller is on as well, who is one of our crisis services coordinators. And then I believe that we have a member from our National Youth Advisory Board. Malachi is on the call as well. If I have missed anyone, I apologize. It was certainly not intentional. So with Brad and Stephen, thank you. Brad Potts is on, who is one of our crisis services supervisors, as well as our resource coordinator. And then Stephen Berrigan, who is our quality assurance guru, is on as well and helps pull some of this great information and data. So now we're just going to get started and jump into things. I think if we can go to the next slide, we'll get started here. Okay, so just for those of you who may not be as familiar with the National Runaway Safe Line, just want to give a little bit of an overview of who we are and what we do. The Safe Line works to ensure that young people who have run away, are experiencing homelessness, or are facing some other type of crisis that may precipitate homelessness and or a runaway episode or general crisis, are safe and off the streets. We have been doing this work based out of Chicago, but serving young people ages predominantly ages 12 to 21. But as we get into the data, you'll hear that that's shifted a little over time. But we have been doing this great work based out of Chicago's for just going into 51 years. We do also are home to and operate the federally designated National Communication System for young people experiencing crisis or who are considering leaving home or experiencing homelessness. And then really, on average, about each year, we make about 125,000 different connections to offer help and hope through our range of resources and services, our online services and crisis services, as well as some of our other resources. This is a combination of the different spaces and ways and places that we work, not only the counting of our crisis connections, and we'll again dive into some of that information in just a moment. So what do we actually do? What do some of our services and support offerings look like? Certainly through our crisis services, which is comprised of a traditional hotline, that 1-800-RUNAWAY number, as well as our online crisis services. We offer this support system 24/7, 365 days a year. There is always a live person on the other end of that contact, be it through a traditional phone call or our digital offerings, our live chat, our email, and our online forum. That live voice is comprised of paid and trained sorry, just lost my train of thought, but comprised of a paid staff as well as a amazing group of volunteers who are also trained to be on our lines and answering crisis contacts when young people, families, or service providers reach out. Those services are very much steeped in a trauma-informed, solution-focused crisis intervention model. All of our services are free, and we work to make them as accessible as possible via different means and mechanisms. And then within the framework of the crisis services that we provide, there are a few other components to that work that just to call out. Certainly the information and referral component is one of the major pieces that we do. So the way that I always talk about the Safe Line in our crisis services work is we are a central connector. We are here at any point in time, day or night, round the clock when a young person is facing crisis and does need somebody to reach out to for help and hope. And then we are also here, though, to make sure that they are connected to and have access to longer term support systems and existing services within the local community where they are contacting us from. We also provide a message service, which really is focused on opening up lines of communication. It's a way to connect young people back with their families or vice versa. It's a way to relay a safe message. So for example, a young person can leave a message for a parent, hey, I'm safe, I'm in a safe place, I just am not ready to talk. And then our team is available then to kind of work with them and try to open up those connections and conversations between the young person and family guardian or wherever they have left from or are trying to get to. And then finally, our Home Free program, which is a national partnership with Greyhound, which has been in existence since 1995. And this longstanding partnership really enables us to provide a free transportation option for young people who are looking to return home to a guardian or to an alternative living arrangement. We're not going to get too much into detail on the service side or those components. It's just a little bit of a quick overview. Some other things just to consider beyond our crisis services is we operate a really robust arm of outreach, engagement, and awareness that offers free educational and promotional materials, our Let's Talk 14 module prevention curriculum. And then we have blogs, our Let's Talk podcast, which Christopher is the host. And I believe a new episode either dropped or is dropping today. Really encourage you to be able to spend some time listening there as well. So that is the Safe Line in a nutshell, very quickly. And then one of our big pieces, certainly around our outreach, engagement, and some of the national work that we do is around National Runaway Prevention Month. Hopefully, if you are on this call and joining us today, you know that it is National Runaway Prevention Month and that today is National Wear Green Day. If you haven't done so already, find something green wherever, put it on, take a selfie, take a group picture from your offices or your teams, post it on your social media channels and tag us with the hashtag NRPM 2022 and really join and be a voice. As just a frame of references, why wear Green Day and why post this? It's just a reminder, the color green is really symbolic of safety and a connection to hope and help for young people, and really started many years ago as part of the Green Light Project, which again was a symbol for young people for a safe place to find shelter, solace, or support when needed. So I'm going to let this short video tell the rest of the NRPM story, and then we'll keep going.
There are approximately 4.2 million young people living in the streets, in shelters, or couch surfing each year.
Youth experiencing homelessness face dangers on the streets and may have difficulty finding food, accessing healthcare, and remaining in school.
Youth homelessness is a very real problem affecting both urban and rural communities across America. About 1 in 30 teens between the ages of 13 and 17 experience homelessness each year. About 1 in 30 teens between the ages of 13 and 17 experience homelessness each year.
These are classmates, friends, and other young people who may not have a safe place to go at the end of the school day.
It is critical that we work to prevent and ultimately end runaway incidents and youth homelessness.
One way to support young people is by joining National Runaway Prevention Month, or NRPM. Every November, the National Runaway Safe Line leads this important public awareness campaign to shine a light on the issues facing youth who have left home due to family conflict or other crisis, or have experienced homelessness or housing instability. It also is an opportunity to spotlight resources available to support youth and young adults and to empower communities to take action.
NRPM is successful because of the incredible community of partner organizations who participate in the campaign. Partner organizations and youth ambassadors from across the country are helping to spread the word and shine a light in their local communities about the issues facing young people who have run away or are experiencing homelessness, and the critical importance of prevention and the prevention work that we highlight during NRPM.
Partners share information and data on social media, host special events, engage local governments to issue proclamations, and light buildings in green, the color of NRPM, and so much more.
Join us as a National Runaway Prevention Month partner. NRS provides support and resources and invites partners to participate in several national events, such as the Twitter chat, Wear Green Day, and Project Green Light.
Together, we can help young people reach their full potential and enjoy fulfilling lives.
For more information and to register as a partner, visit 1-800-runaway.org/NRPM.
All right. Well, I know there was a question in the chat about where to be able to find that video, and I believe that the link has been posted. Please feel free to use that in any way that will be of help in your programs, in your communities, or with your events. So please take advantage of that, as well as the many other resources that are available on the website and on the NRPM site in particular. I'm not going to spend a lot more time on this or on this particular slide. It's just to highlight again, we still have plenty of fun, engaging events that are coming up after Wear Green Day. We are excited and getting ready for our Light the Night event, which I think we had talked about. There are some of you have worked hard to have buildings or monuments or other landmarks within your communities lit up green as part of this effort. And so we will see this happening across the country, and we'll be sharing all of this on social media and encourage you to do so as well. So one last thing just to mention, which is certainly part of, if we can move on to the next slide, which is both part of National Runaway Prevention Month, but is also just kind of a good segue into starting to talk about some of the data and some of the information that we're going to share, is our Youth Ambassador Program, which we have launched as part of National Runaway Prevention Month. It is not new this year, but certainly our efforts to grow and enhance this will continue. And the toolkit that is available, which is a youth-specific toolkit available on the website, is really a tool that can be used throughout the year. And there are ways to engage young people, whether in school settings, after school programs within your shelters or basic centers, or any sort of program working with groups of young people. This is really just a great way to include young people in this discussion and in the conversation, and to really find ways to amplify the youth voice and to find ways to engage and participate. I think it will be super helpful if you haven't already, if you can mute yourself, we would really appreciate it. So thanks so much for that. And so also just this Youth Ambassador Program feeds right in and really aligns well with the importance of making sure that young people are part of the solution and part of the conversation around how do we work to end youth homelessness. So when we look at the scope of the problem and to sort of, or the challenges that we're facing, if we can move to the next slide. And I believe this is still me. Yes, Sam, I think this is still me. I think if it isn't, I'm going to just jump right in as we sort of set the stage to begin to dive into what does the 2021 Crisis Services and Prevention Report tell us, and what Sam and Melissa will be addressing is when we sort of back out from the National Runaway Safe Line and look at the overall scope of the problem and the scope and the reach of youth homelessness across the U.S., we know that nearly 4.2 million young people between the ages of 13 to 25 will experience homelessness at some point in the US each year. So it is a massive number. When you think about it, it is population-wise, it is larger than some communities and some states themselves. It is important to think about it in terms of when we talk about the data and we talk about who we're reaching, and you think about your own programs, how many more young people need our services, our resources, and the connection to the support that we are offering, and working to ensure that not only that those services are available, but that they continue to know how to access those services, and that they're accessible in a way that makes the most sense for young people and to meet their needs. And we also, so I'm gonna just, with that, I'm gonna turn this over to Melissa, yes, and let you kick things off as we jump into the heart of the report.
Thanks, Susan, and thanks to Sam as well. I also want to acknowledge my co-author in this work, Maddie Youngren. Chapin Hall's been really lucky to work with NRS over the past few years to understand what their crisis services data say. So this year in 2021, like in previous years, we've had the opportunity to analyze the data that's been self-reported by the contacts who connect with NRS. And so basically, as Susan mentioned, these are young people, these are friends, family members who are reaching out to connect to try to figure out how they can get the supports that they need or their loved one needs. So in 2021, we have taken a similar tact to what we've done in previous years, and we also highlighted what we've learned based on some of the trends we've seen since the pandemic. And this is one of the benefits of having done this for the past few years, is that we are able to dig into those trends and try to understand exactly what happened to young people experiencing homelessness or at risk of homelessness across the country as the pandemic intensified and then started to are we saying return to normal? I think that's where we are now. Ultimately, this report is really important because it has helped NRS to see what needs are jumping out, and we'll talk a little bit about what those needs are. Next slide, please. Thank you. So, as I mentioned, one of the really important things to know about these data is that they are voluntarily reported. So NRS has frontline staff, as Susan mentioned, and they are not using a formal or semi-structured protocol when young people are connecting with them, or friends or family are connecting, either through the hotline or the other methods of communication. There's the process that Susan showed that allows those frontline staff to collect information through the course of these conversations. And so all of this information is what that person, that contact, feels comfortable reporting. This has some implications for the data that we'll talk a little bit more about. But I think it's important to know that in 2021, there were almost 36,000 contacts that came through the 4 methods of communication: the hotline, the chats, the email service, and the forum posts. And in the process of preparing these data for analysis, we identified about 200 records that didn't meet our thresholds for data quality. And so we've dropped those records. And ultimately, our analytic sample for this analysis included 35,406 contacts. For this analysis, we addressed some of the questions that I mentioned we've been looking at in previous years. So we've been trying to understand every year who's contacting NRS, how are they reaching out to NRS, what do they need when they reach out? What is the presenting problem that's emerged? We also have examined what sort of resources are available to these contacts. So NRS has a large inventory of resources that are specific to communities, and so recognizing where contacts are and seeing what sort of connections they're able to make to those resources, as Susan mentioned earlier, really being that connection point. We've been able to dig into that question as well, and that gets to the question of referrals. And as I mentioned, we've been able to look at some of the trends that have emerged between 2019 and 2021, so really capturing that period of time between before the pandemic started to the height of it to now, at a place where we are finding our new normal. Next slide, please. So this is the 2021 crisis contact map, and you can see when you look at this map of the US that the states that are shaded in a darker blue have a higher volume of contacts. So unsurprisingly, very large states like California, Texas, New York, Florida have a very large volume of contacts. You can see on the right-hand side, these are the states with the most contacts. But what's really important to note is that over the years, these states in the middle that are now starting to turn a sort of medium blue have in previous years been much lighter. And so I think Sam or Susan will talk a little bit at the end of this talk about how much their outreach efforts have grown, and it seems to be reflected in these growing numbers of contacts in these states in the middle of the country. We know that in states that are, or communities that are more rural, that it's not a question of homelessness amongst young people not existing. It's simply a question of the recognition and the visibility of youth homelessness in these places. So it's a great sign to see that there are more contacts from these states that have previously been later, because it indicates that these are young people who are getting connected to services. Next slide, please. So this slide shows the method of contact. And as I mentioned earlier, there are 4 different ways that contacts were reaching out. You can see from this figure here that the bulk of these contacts are coming through the chat service. And we know from some of the other analyses that we've done that it's really young people who feel comfortable using the chat service, and they really drive this large proportion of contacts coming through the chat service. After the chat service, we know that about 1/3 of contacts use the hotline. And we know from those analyses that these are much more likely to be parents, adults, other members of the community, but not young people. And then as you can see, about 12% of contacts come through both the forum and the email service. I think it will be unsurprising to most of you that the bulk of the contacts learned about NRS through the internet. So almost about 82%. This feels unsurprising based on all the work that NRS has done in recent years to really leverage social media and try to build their profile and really meet young people where they are, which we know is the internet. So I think this is not surprising, but still a really interesting finding that the internet really drove the contacts connections to NRS. And then after that, oh, sorry, just wanted to note there were a couple other ways that folks came through, such as word of mouth and previous calls, but you can see that those really make up a very small proportion of the crisis contacts. Next slide, thanks. So this slide shows the demographics of the contacts who connected with NRS in 2021. On the left-hand side here, you can see the age breakdown of those contacts. And we can see that almost 10,000 young people between the ages of 15 and 17 reached out to NRS. So this is almost half of all of NRS's crisis contacts. There are about equal proportions of adults between the ages of 18 and 21 and 22 and older. But I think what's really notable is that about 5,000 young people between the ages of 12 and 14 are reaching out. And there are almost 1,000 young people under the age of 12. And Sam will talk a little bit about the trends we've seen in recent years, but this really does point to, I think, the possibilities for prevention, making sure that young people are getting connected to services before they have left home, whereas we know it's more likely that many of those young people between the ages of 18 and 21 are probably already out of places where they don't feel safe. In terms of gender, we can see that about 2/3 of the crisis contacts identified as female and about 1/4 identified as male. Notably, 10% of the crisis contacts who reached out to NRS in 2021 identified as transgender and non-binary. We know that trans and non-binary youth are more likely to experience homelessness. And so I think it's in line with what we know that there is a disproportionate representation of trans and non-binary youth connecting with NRS for resources. And then in terms of race, here we see that almost half of the sample of crisis contacts from 2021 identified as white. This might be in line with the proportion of white young people overall across the US, but it's not aligned with what we know about the proportion of young people experiencing homelessness. So we know that BIPOC youth, Black, Indigenous, people of color are much more likely to be represented as experiencing homelessness due to a range of systemic factors. And so it's surprising to see such a large proportion of contacts identified as white. You can also see that there are about 1/4 of the contacts identifying as Black or African American and 16% identifying as Hispanic or Latinx, with other groups much more underrepresented. So raising some big questions about who's reaching out and how are they connecting. Next slide, please. In terms of the issues that are coming up, as I mentioned, these conversations happen organically when contacts connect with NRS's frontline staff. The contacts can select or discuss from any number of issues that they're experiencing. So these options, these topics here are not mutually exclusive. It's important to note. So it's feels unsurprising based on what we know about youth homelessness and how it happens, that nearly all of the contacts who have reached out, 85%, indicated that the major challenge they were experiencing was family dynamics. After family dynamics, you can see there's a large drop off. About 1/3 of the sample was reporting experiencing emotional or verbal abuse, with about 1/4 reporting mental health challenges, and another 1/4 reporting peer or social issues. So sorry, which includes problems with friends or gang or cult involvement. Next slide, please. And then finally, I think it's just important to talk about where young people were located when they reached out on their own behalf or someone reached out on their behalf. And we know from in 2021 that about half of young people were still at home when they or someone on their behalf connected with NRS. And this really points to the opportunity for prevention, knowing that young people are sort of seeing this possibility on the horizon, or their family members are seeing this possibility on the horizon, and wanting to make sure that there are resources available and there are supports available for this young person before these issues escalate to a crisis. And then I think it's important to note that about 10% of the youth who were connected with NRS were staying with a friend's house, and about 4% were at a relative's house. So this type of couch hopping or couch surfing is not uncommon amongst youth who are experiencing homelessness. And we know that sometimes these situations can be safe and sometimes they may not be safe. So it's important to understand a little bit more about what these young people in particular need. And then alarmingly, about 6% of young people were on the streets. And so this is where NRS is so vital with making sure that those young people are connected with services and resources in a very timely fashion. Next slide. I think this is Sam.
Yeah, thanks, Melissa. That provides a really helpful baseline for 2021. And I'm going to jump into talking about the information, the patterns, the trends that we've seen emerge from 2019 through 2021. So the last 3 years that we've partnered with Chapin Hall on these types of reports. So you can see here, the next couple of slides are going to have similar graphs. 2019 is going to be in green. 2020 is going to be in blue in the center, and then at the bottom you're going to see 2021 in that kind of magenta color. So here, this slide is about crisis contacts reaching out under the age of 15. So we talked a little bit earlier about while ages 15 to 17 kind of remain that largest bucket or category of contacts, if you will, that reach out to the Safe Line. Contacts under the age of 15 are actually the fastest growing age group that we are serving and have served over the last 3 years. That number, so in 2019, that was about 3,500 contacts. That jumped up to 5,366 in 2021. So that is a overall increase of 53%. Next slide, please, Christopher. Okay, so then within that group, there's a sub bucket we're looking at here, and that is the contacts under the age of 12. So from 2019, we had a little south of 300 contacts reaching out under 12, but a little bit over 700 by the time we reached 2021. So that is an overall exponential increase of 153%. This is alarming when you consider, the trajectory of those young people and the depth and the breadth of the supports or resources that they might need over time, when we're considering that traditionally most of the contacts that are reaching out to us are doing so 3 to 4 years later. So there's that piece. But on the flip side, this is also a really critical opportunity for prevention. And can be used to our advantage. So I'll get into that a little bit more in a bit. So Melissa also mentioned that we've also seen a substantial rise in underserved populations reaching out to the Safe Line. So here you can see the overall increase in young people that identify as transgender or non-binary. So in 2019, there was a little over 900 contacts that identified that way. And then by 2021, that number was just a little north of 2,000. So that's an overall increase of 134% between those 3 years. And then an overall increase in young people reaching out that are Black or African American. So in 2019, there was just under 3,000 contacts that identified that way. And then by 2021, there was a little over 4,000. So that comes out to an overall increase of 47%. And Melissa touched on this as well, but this applies to this slide and the previous one. But we know that many groups are overrepresented in terms of the need, in terms of experiencing homelessness, but that's not always reflected in the data sets about who's reaching out, right? You saw that in our 2021 numbers. The majority of contacts, or the highest group that reached out, was young people that were white or Caucasian. But for the first time in 2021, we actually saw that the sum of the other races or ethnicities actually was the majority. So it might seem like it's alarming for there to be an increase, but it might actually be a good thing that we're reaching who we think we need to be reaching. Next slide, please. Okay. So mental health, Melissa also mentions, that continues to rise dramatically. And over the last 3 years, that went up, or between 2019 to 21, I should say, not the last 3 years, that went up 40%. So in 2019, there was a little over 4,500 contacts that reported mental health as a reason for reaching out. And then by 2021, it was about 6,500. And so while it's also really important for us to contextualize this here, mental health has been increasing in the last couple of years in our top 4, top 5 reasons. But prior to that, mental health really hadn't come up as a presenting issue for decades. So not even within the top 10. So we're paying really close attention to that. Next slide, please. Okay, so this slide is not necessarily broken down in the data report, but we like to share that here to just give you some more context around what mental health means. So these are some of the more specific issues or struggles that are being reported. So as you can see, feelings of depression are most prevalent at 57%, followed by that second bullet point there is more of like a general or not specified kind of bucket. For kind of just experiencing a general like mental health need, and that's at 36%. It's also very concerning that 25% of the contacts that are reaching out reporting a mental health issue are citing that they feel suicidal, and 9% of those contacts are reporting a prior suicide attempt. And then additionally, you can see here that 11% are reporting self-harm. I should have mentioned it to start this slide, but I also just want to note that you can mention multiple subcategories during any sort of crisis contact. So this won't there can be multiple things going on and it doesn't necessarily add up to 100. So then when you kind of look at that other column there, these are the options that we discuss with the contacts that's reaching out. So when mental health issues are reported, the conversation can go in a variety of different ways and we can respond in a variety of ways. So immediate safety is always priority, as you can imagine. And so we'll assess for suicidality or plans to harm oneself, or if anything of that nature is mentioned or like the tone of the conversation makes it clear that should be addressed, we're going to address it. And depending on the type of situation, we're able to refer contacts to a mental health professional. You can see over there that is about 1/3 of the time, or other support hotlines. We're also often able to encourage young people to make a plan with a young person or connect with a family member or a friend to talk about what they're experiencing, what they're feeling, and go from there. So some of those others might not seem so intuitive or like directly related, but often when we get to talking about a contact expressing some mental health concern, we usually get to I'm feeling this way because of. And so those underlying dynamics may better correlate with some of the options discussed or those referrals that you see there. So somebody can say, I feel like I want to harm myself because I'm experiencing abuse at home, or I'm having trouble in school. And so depending on the context of what's shared there, that can also prompt those other referrals. Next slide, please. Okay, so what are we doing about it? How are we responding to what we're seeing in the data? The trends have had a pretty significant impact on our operations and the priorities that we have here. So I'm just going to go through some of the strategies that we are incorporating to more effectively reach young people, as well as how we're refocusing our prevention and education efforts. So we remain very committed to centering youth voice in all that we do. We have and continue to work on expanding our youth advisory board and incorporating them more closely into our programs and services and helping them really drive our outreach techniques. And given the data around this younger age group that we've been talking about here, the under 15 reaching out for support, we're investing in additional research and training for our crisis services team, our staff and our volunteers, and are really starting to develop more tactics and more developmentally appropriate crisis intervention strategies to effectively communicate and meet the needs of the young people reaching out. So just when you just really take a step back and think about it, you can't talk to a 10-year-old the same way you would to a 17-year-old, especially when you're talking about such serious issues as mental health. And additionally, we're going to be working on, and have already started working on more traditional or more inventive or newly emerging referrals for this younger population. More of the traditional service referrals for this group are limited or really targeted at parents. So just exploring alternative resources there and tools that we can use to more effectively serve, especially that under 12 group. And then we are, can I jump to the next slide, please? We are working on building out our resource directory. So continuing to build out the list of those referrals for the young people, but also mental health needs, whether that be a mental health resource or making sure that we're having more organizations in our database, mental health professionals that can respond to the need. And then Melissa touched on this before, young people are still reaching out from home. It declined from 2020 to 2021 in a way that really makes sense for this shift in the pandemic a little bit here, but that's still over 50%. So over half of contacts are still reaching out to us while they're at home. And that really still highlights the need for our prevention efforts here. So we recently updated and modernized our Let's Talk prevention curriculum, runaway prevention curriculum, and we're continuing to do so this year. So that's to more effectively reach youth from a broad spectrum of audiences, to be more adaptable, to be more user-friendly, especially considering all of the different age groups. And then as our contacts continue to diversify, we're also continuing to learn and to expand the way we do outreach and our engagement. So can I jump to the next one, please? Thank you. So Melissa shared earlier that most of the contacts in 2021 that learned about NRS did so online, and then accordingly reached out to us through digital means, whether that be chat, through email, or through our online forum. We didn't get into that overall increase before, but between 2019 and 2021, we saw an increase of 29% of young people reaching out to us through our chat service. And so really what we've done to respond to that is to revamp some of the older platforms, like our method of outreach on the older platforms, and joined the new ones, right? To make sure we're meeting young people where they're at physically, or I could say technically, and also communicating in ways that resonate with them. So more directly appealing to the target audience in layman's terms, and switching up how we deliver messages targeted at parents and then targeted at service providers. We've also been super diligent about engaging with the posts, liking comments, responding to comments, and keeping that conversation going directly in that public forum. And our messages, you can see here on the left-hand side, this is our Instagram page. Our messages or our posts range from highlighting our services to providing valuable statistics, highlighting resources for young people. And many of those, again, have been adjusted to address the emerging challenges that are impacting young people today. So increased mental health resource posts. You can jump to the next one. So this slide is just a bigger look at some of our more updated posts that we've made recently. You can see one on World Mental Health Day, one on our Let's Talk podcast, one on our forum, and one on RIPTA. I want to focus here, it leads me into the next slide on this one about our forum. Oh, can you go back, Christopher? The post about the forum here, I was trying to think about it in the past. I've never really heard a forum explained this way, and yet we all know that's exactly what a forum is for. So just really being very clear about what the resources can be used for. So when you have questions, but you're not ready to talk about them, you're going to go look for an answer because somebody might have already had that. That's exactly what our forum is. So you can jump to the next one. And we know that that's effective and helpful for young people because it is a really big step to reach out. It's scary. And doing some of this can help build trust in us that we do know what we're talking about, that we're here to help you, and that if you do need to reach out, that we're going to be a good source of support. And for some of the more kind of like one-off question type things, you might not even need to reach out and talk to someone about something. It might be something that you can just get answered very quickly. Next slide, please. So I already mentioned it, that we are expanding to newer platforms to make sure that we are where young people are at. And so that means that we are on TikTok and we are on Snapchat now. This slide's really just highlighting a couple of numbers from a recent campaign we did around back to school. So it was a 16-day campaign on TikTok and Snapchat. You can see the total number of impressions there is over 1 million. And then the number of clicks or swipes that led to our website that generated from that. We found that of the groups, of the people that were responding, females aged 13 to 17 are the ones that interacted most. And then you can see they're the top 3 states by the number of viewers. What I kind of want to, it's not necessarily directly related to this slide per se, but I think it can encompass kind of the results that we're seeing here. You heard us talk about the increase in transgender or non-binary youth reaching out, as well as Black or African American contacts. And while we can't say so definitively, right, this could be because we've intentionally been focusing some outreach on youth of color, youth who identify as LGBTQU or LGBTQIA 2S+, I want to make sure I get the full thing out, and youth from more underserved or marginalized areas of the country. And we've also found that just in general, varying the content, utilizing language that appeals to different audiences or genders or age groups, and includes especially feedback from youth with lived experience is successful. So I'm going to be mindful of time and jump to the next one and kind of breeze through these. So we have a number of resources that are available for RHY providers that are already ready, set to go. If you can jump next, Christopher. You saw all of our data, right? That was the national lens and the 3-year trends. But we can also provide data on a more individual or granular basis. So we can do that statewide. We can even do a couple of states or kind of like a regional look. And then we can do county data as well. And depending on the number of contacts in a hyper-local area, like sometimes we can provide it at the zip code level. And that can include all of the things you kind of saw already, whether that's the number of contacts, how people are reaching out, who's reaching out, and reasons why. And that usually takes a week or so to turn around. We talked about the Let's Talk curriculum. I'm going to jump through that. That is available on our website. And then there's also an opportunity for you all to join our database at any time. The link is right there. It's at 1-800-runaway.org/service providers /partner with us. If you are not sure if you are listed in our database, go ahead and type in a request, and we will let you know if you're already added. And if not, we will get you set up there. Next slide. Okay, I wanted to make sure I left a little bit of time for questions. So I really appreciate you all being here with us. And I am here, and Susan and Melissa and some of the other members of our team are all here to any questions or discuss some of the data if you wanted to dive a little deeper. And I didn't look at the chat while I was presenting. Were there any that came through?
I've been checking it. I think they're more just some really great comments, which we really appreciate. So if you have questions, feel free to post them in the chat or unmute yourself. I think we're still good if you want to do that, just to raise the questions. If not, we are certainly always available to field those questions after the presentation as well. So we'll give it a minute here. So I think if we
I actually have a comment or a question, if you don't mind. Can you, I'm on my cell phone, our internet's down in my office today. Can you hear me?
We can.
Okay, thanks so much. So I really appreciate the statistics and all the information that you provided. That's so helpful. And I think my concern in working with the unaccompanied homeless youth is that gap after they graduate high school, for me, because I work with specifically with school districts, between if they decide to go to college or they're unsure, and that housing and the potential for them to be homeless during that. And so because there's not a federal law that colleges have to designate homeless liaisons. I know that some colleges do that, which is excellent. I don't know if there are suggestions or if you have relevant data that relates to the comments that I've made, just how I could, really help them or guide them towards, resources that could provide that stability, after that, graduation from high school. Thank you.
Yeah, as far as the data goes, that is something we could definitely look into for you. I can drop my contact information in the chat here if you're curious about a certain area. As far as resources as well, we do have resources ranging up to for that 18 to 24 group, and sometimes a little bit older. So if you are needing any of those kind of transitional supports, you can reach out to or provide our contact number or our website to young people to reach out directly for those supports. Let me put my name in here.
I know Sarah Goldrick-Rab at the Hope Center has also been doing a lot of research on the material hardship needs of young people in college. And so this is not going to help answer your question around getting these young people that you work with connected to resources, but it also might help you to understand this challenge more broadly at the national level. Chapin Hall also has a brief on the intersections of education and homelessness, and we did draw on some of the work from the Hope Center that does speak to this issue. So that might be something to look into as well, and I can drop the link in the chat.
Did we have any other questions? Okay.
All right. Well, we really appreciate everyone being here today. A special thank you, of course, to Melissa and your partnership and the partnership with Chapin Hall. We are so grateful for this and the work that we are able to produce as a result. And of course, again, thank you to the Family and Youth Services Bureau for their support of our work as well. So I will send you off on this Wear Green Day. Hopefully you are excited to be showing your support and posting your pictures, but certainly as you return to your communities and your work and your day, as questions come up or thoughts come up around what you've heard or what we've spoken about, let us know, reach out, and we are happy to keep this conversation going.
Thank you, everybody.
Thank you.